Hi, everyone. Welcome. I am Jamie Jeanette. I am the community engagement specialist for the homeless, for H3, Health, Housing, and Homeless Services. And one of the things that we do in our office is help put together these big community forums. So I'm really, really excited to have you all here. The format of today is that we are going to have a panel. Well, first of all, actually, Dana Ewing, who is with our data research and evaluation team, is going to present some data about family homelessness, what we know, just in terms of numbers. And then we're going to have a panel presentation by a number of different folks in our community who are representing some different voices. So some provider voices. We actually were supposed to have a person with lived experience, and she's not able to make it today, which I'm really sad about. But what I will say is then the last chunk of our meeting will be conversation, opportunity for questions and discussion. So I especially want to encourage those of you that have a lived experience of homelessness, particularly if you had children under 18 when that was happening, feel free to share your experience. So I am going to hand things over to Dana to do some data, and then we're going to have our panelists actually introduce themselves so you can kind of understand what perspective they're holding. I'm going to ask them a couple of key questions. They're going to answer them kind of in round robin format, and then we'll go to the discussion. I will note that this is being recorded so that folks that aren't able to be here can learn from this and appreciate it later. And you can always, we're going to have time for questions at the end. You can also put your questions in the chat if you don't want to forget them. And when it's discussion time, we'll go back to the chat. We are going to keep everyone muted just to minimize the chaos. But feel free, you can also back chat me on the chat function if you have a question that you don't want to have shared publicly. That's fine, and we can share that information out. So with that, I'm going to turn things over to Dana. She's going to provide us some basic information about family homelessness in Contra Costa. Dana, if you're having trouble, let me know. You should be able to share. Oop, and now you're muted. Oh, here we go.
All right, so I'm going to share my screen, and I'm going to shut so I can't see you. Oh, there we go. Okay, so let me present. I tried to set this up earlier, and then I lost you guys. So let me move this over and present.
Great. And there you go. Perfect. You're good. Go for it.
Great. Okay. So I'm Dana Ewing. I'm with H3, and I'm going to do a very quick overview of the data we have to paint the picture of family homelessness in our community. Before we dive in, family homelessness is actually challenging to capture in our system of care because so many families couch surf and jump in and out of our system of care. Unlike a lot of adult-only households, they tend to stay and be more visible to us. So we'll talk about that a bit, just some of the challenges. Well, I won't talk about a lot of challenges, but you'll hear tidbits as I go through this. This is going to be very quick. Feel free to ask questions at the end. But just as an overview, the Contra Costa County's Homeless Continuum of Care serves people that are having a housing crisis. And it's a variety, the CoC is a variety of stakeholders that work together and collaboratively to prevent and end homelessness. And one of the things that the CoC does is monitor services to understand who's accessing services, how they're coming out of the system, whether they're getting housing. And it also allows us to look at different demographics. And so today we're talking about households with children or families. So the CoC has programming that falls under multiple categories. Most households with children access prevention and diversion or crisis response. And there's like two broad categories. Prevention and diversion are for folks that are about to lose housing. There's a HUD definition called, that's imminent risk, meaning within the 2 weeks, they think they're going to lose housing. And services they get for prevention and diversion include case management, conflict resolution, and financial assistance. And it's meant to be a short-term solution to make sure people do not enter the literally homeless system of care. And literally homeless is a crisis response. We kind of lump the programming that falls under this category under crisis response. And this is for folks that are homeless. They no longer have anywhere to stay. They're either in shelters or they're living on the streets. It does not include couch surfing. So, if someone's got a precarious place to stay, they're actually in the prevention diversion category, not in crisis response. So again, what I was talking about earlier is families will tend to kind of bounce back and forth, because hopefully family members, friends and family can kind of keep them for a night or two, and then they're back in our services, and then they might go to another family's house. So that bouncing around makes data collection a little challenging. Crisis response includes outreach. The services that fall under crisis response include outreach, interim shelters, emergency shelters, provision of basic needs, such as hygiene kits, referrals to healthcare, some case management, housing navigation, and it includes rapid rehousing. And that's in bold here because I know sometimes rapid rehousing falls under a housing program. And when we look at crisis response, we include rapid rehousing because people enter that programming literally homeless. So what we're going to look at today is calendar year trends for 2019 through 2021 for families accessing services. And what we'll see is some trends that sort of happen because of programming related to COVID-19. So there was part of the programming shifts to address the pandemic were that there was no longer a limited length of stay in shelters. And that resulted in, so we had just the same number of beds. We actually have had an increase over time, but people were staying in shelters longer, which meant there was less turnover. So families and adult only, you'll see, were impacted by this because while we had the same number of beds or more beds, there wasn't turnover. So folks weren't able to get in as easily. And we also we had a prioritization for seniors and people with chronic health issues during COVID to put them into shelters to get them off the streets with the intention of preventing the spread of COVID-19. And so it did impact sort of the outcomes of our families. And you'll see that. You'll see that there was an increase in the number of unsheltered families and that there was a longer length of time homeless. So the families were experiencing a longer time that they were literally homeless. Okay, and that was an overview because there's gonna be a lot of data that we're gonna go through quickly. So here is how families access services from 2019 to 2021. And so you'll see in 2019, the green bar up at the top, this first one here, these are folks that entered in households. This is the number of households that access crisis response. This means they were literally homeless. Excuse me, and you can see that there was a dip in 2020 and then it sort of evened out in 2021. And this is likely reflecting access to shelters, access to programming, again, the prioritization for adults with chronic health conditions. But you can see it evened out as we are stabilizing, hopefully, in 2021, they were able to access services a little bit easier. And then you can see an increase in 2020 into prevention. That's the blue bar at the bottom. And again, I think it's just about accessibility to different programs. There's additional data. I forgot to mention that. So that previous slide, this was our service data in HMIS. When people enter our services, we collect data and we identify who's entering our services. This is additional information that we get from the County Office of Education. They track children that are coming into their public schools and identify as either at risk or literally homeless. And their data is actually not integrated into ours, but it's very important to remember that there are additional families out there being served that are not in our system of care. So if in addition to the 600 and some odd families or however many that was, I forget the number now on the previous slide, but in addition to our data, you can see there were 2,449 kids in calendar year 2021 that qualified for services for kids at risk or literally homeless. So here we can see some sort of shifts in how families were accessing our services. So before COVID, 26% of households access outreach, and outreach is for people that are sleeping outside. They're unsheltered families. So before COVID, 26% of the households accessing our services were using COVID. we're using outreach. And then you can see a large jump in the proportion of families that used outreach after COVID. And again, this is a reflection of maybe harder to get into services, shelters. Also, a lot of families and where people were couch surfing because of the shelter in place weren't able to host their friends or their family members. And so many households with children ended up on the streets in unsheltered situations. And you can see this proportion. Almost 2/3 of families were sleeping outside at one point during 2021. And then at the same time, trying to show that same how people access shelters and rapid housing. So on the left, it's a lot on this one slide, but on the left-hand side, you can see that the proportion of families that accessed our services and used shelters didn't change a lot. So it was about a quarter, 26% in 2019, and then 21% were accessing shelters in 2021. So not a huge change, but there was a decrease. What's more significant is that the percentage of families that were using rapid rehousing. And this is critical because rapid rehousing is a housing program. So there's a higher rate of exits to permanent housing. So it's a very important program in terms of getting out of homelessness. But you can see there's a decrease that 39% of the families in 2019 were enrolled in rapid rehousing compared to 26%. And that, again, is a reflection of two things. We know that there is a prioritization for people with chronic health conditions. And we also know there was just less housing. With the shelter in place and landlords having fewer housing opportunities, people were just sort of stuck. So speaking of being stuck, what happened then in the end is many people, okay, let me explain this graphic first. On the left-hand side, it shows that in 2019, 55% of the households with children or families had been homeless for a year or less. But by 2021, the percentage of households with children that were homeless for a year or less decreased. And unfortunately, on the right-hand side, you see there's a decrease in that shorter time frame, and far more were experiencing homelessness for 3 years or more. So you can see for the four categories. Either they were homeless for a year or less, for 1 year, 2 years, or 3 years or more. And you can see that in 2021, families were just experiencing homelessness for longer periods of time. And again, it's that whole big picture. What we're trying to show here is that many people were just stuck in the system of care because of lack of affordable housing, just different access to services, and it definitely impacted families. And then related, these are the outcomes. What percentage of families exited to permanent housing? And what we're doing here is comparing how all households in our CoC, so everyone that accessed crisis response services, compared to families. And you can see, we'll start with all households. There was a decrease. 21% of all of our households accessing crisis response exited a shelter in 2019. Not a huge percentage, which is something that we work on constantly, looking for housing opportunities. But that percentage then decreased for all households down to 15% during 2021. Again, totally related to housing opportunities, just less availability. So many people, again, stuck. But the decrease was much larger for families with children. So generally speaking, families with children, households with children, have a higher percentage rate of exits to housing. Usually it's half of the families that enter our system of care exit to housing, which is fantastic. And then unfortunately, in 2021, about a third. So again, large impact related to COVID-19 and programming and just accessibility. But I wanted to end on a good note. This was a family that was housed in 2021. And they did give credit, or they gave permission to share this information. It will be in our annual report that's coming out in a couple months. But this is a family, single father of 4. They couch surfed for 15 years, sleeping in a van or sometimes at their brother's house. When COVID hit, they couldn't stay at their brother's house, and they ended up, being literally homeless and not able to couch surf. And the beautiful thing is I really like this example because they used so many services in our system of care. They worked with outreach, then they were referred to shelter, and they worked with a case manager, and they worked with support services. They received a housing voucher, and then they were housed. And this is just a great example of how many programs and service providers work together collaboratively and can get people housed. And that's it. I think we're going to save questions for later, unless maybe there's a question that's very specific to get around the big picture of things, but we'll save it for later.
Thank you, Dana. I really appreciate it. That was fantastic.
Great.
And I will say at the end of this, and I didn't mention this at the beginning, so we will be posting a recording of this whole event, and we will be posting any slides that were shared, including what Dana has, and then there might be a few other speakers that use a few slides just to describe their agency and their programs. Thank you, Dana, for that, just to ground us in the numbers. So I want to take this moment now to introduce our speakers. So we have about 5 or 6 different speakers, and I just want to name check them, and then I'm going to let folks introduce themselves. And speakers, you're going to have about 3 minutes each. So we were planning to have Lori McElmore, who is with the Resident Empowerment Program for Hope Solutions. She was planning to be here to hold sort of the perspective of somebody with lived experience who has actually been through this experience and become housed. She's not able to make it today. So I'm really sad about that. We will also have our core outreach teams that will be providing their perspective of sort of the outreach. And they're specifically on the family team. We will have Andrea Foti from Shelter Inc. Talking about, so she'll explain, but they have family shelter and also housing programs. So it can kind of speak to that whole spectrum of services. We're going to have Gina Bills from the County Office of Education talking about families with school-age children and some of the challenges facing that population. And then Candy Dupourier, hopefully I'm saying your name right, who is from CoC Kids, that will talk about families with children under the age of 5 and what might be available to them. So with that, I'm going to turn it over. Core, I'm going to let you introduce yourselves first, and I'm going to just keep an eye on time. But feel free to introduce yourselves, your agency, and anything you want us to know about kind of what services and work you all do with families.
I'll go first. Can you hear me? I am Lauren Ninkovic. I am one of the core outreach specialists for the Families CalWorks Housing Works team. And we specifically work with families that are homeless and on CalWorks. And we work with Hope Solutions in the county and a program to try to get them housed through like a rapid rehousing program where they get 6 to 12 months of rental assistance, case management, and whatever kind of help they need to try to get on their feet. And then they eventually take over the full rent after the 6 to 12 month period. But to qualify for that program, you need to be homeless and receiving CalWorks and be in good standing with your CalWorks. So that's the main thing that we do on my team.
Thank you. Robert, do you want to say anything?
Yes, my name is Robert Preston. I'm one of the coordinators here at Core Homeless Outreach. I coordinate the Housing Works team as well. And just like Lauren was stating, we do work with the CalWorks individuals that are on CalWorks as well. We serve a lot of the different families in East County and in West County as well. We refer to several different shelters, which is the Mountain View House and also the GRIP shelters as well. We come into a lot of different barriers getting a chance to place individuals. There are a lot of different barriers that we are struggling with right now. The main one is the availability at this time right now. Currently, there's only about 2 shelters that we refer to at this time. And so one of the other issues that we're running is single fathers and having to place single fathers at different shelters, and the families not wanting to split up at this time. There's only one place, I believe, GRIP, that allows single fathers to be with their kids at this time. Right now, the rescue mission, we refer to them as well, and but they have to be on separate sides, so they can't sleep with their children. The men can, but the women can at this time. Yeah, there's a lot of different challenges serving this population at this time, but we always figure out a way to fight through and to serve our population.
Thank you, Robert. And thank you for queuing up. Just so folks know, we're going to be asking 3 different questions of the panelists. So the first question we're going to ask after introductions is, what are the biggest challenges that you see facing families? We are going to ask panelists to speak to what resources might be the most helpful in their experience, and then what they want people to know. So thank you, Robert, for giving a little preview of that. Next, we'll do Andrea, if you can introduce yourself.
Good afternoon, everybody. Well, thank you for having us here. My name is Andrea Forti. I'm a Senior Program Director with Shelter Inc. And for some of you that do not know Shelter Inc., we have been serving Contra Costa County since 1986. Our main mission is to prevent and to end homelessness. And in order for that, we do housing services. We provide support and resources for all of our participants to become self-sufficient. So we provide a big variety of different services, from prevention to a family shelter. Like Robert was mentioning, we run the Mountain View shelter. We also have low-income apartments. We provide rapid rehousing services as well as permanent supportive housing services. So thank you for having us here.
Thank you. And now, Candy, it'll be your turn, and I think you can share your screen if you need to.
Well, hello, everyone. I'm happy to be here. My name is Candy, and I'm the Child Care Resource and Referral Program Manager at CoC Kids. I've been here over 20 years, and I love what I do, helping families find and pay for childcare. I'm going to go ahead and share the screen really quickly and just share our updated work that we have done during the last 2 years on our website. And I wanted to bring this up because this is the fastest way that you can help a family find childcare. Okay, so they can call this 1-866 number here at the top. They will get a very detailed voicemail on where to navigate what their need is in childcare, or they can click on Find Childcare here. And it will take, hopefully it's going to work. Come on, internet. All right. Okay, here we are. Find childcare. So if they need assistance paying for childcare, they would click here, apply here, and that's going to take them to a website where they can actually put their information, their application at that website, and they can create a username and password and all that good stuff. And that's for paying for care. Now, to find childcare, they can actually click one of these buttons here. It's where the city where they're living at the time, and they can click it and fill it out as a request. Now, what I'm going through, you can also do this on your cell phone, which is really, really helpful. They're very, very helpful fields. And then also they can do it themselves by adding this information to find childcare. They can do it themselves. They can add a zip code where they're looking, or a city, and then they would add, well, I have to go through it. I'm just going to do it really fast. We're just doing introductions, but this is really a big part of what I want to share because it's very important. And then they would click why they need the care, right? Are they looking for care? They need backup care. And I'm going to add homeless to this button here, okay? Because it's very important. I'm glad I clicked it. It's very important that we serve our homeless families as a priority. And that's what we are doing. And we're trying to make sure everything is lining up at this time. So I'm going to make sure that we have the homeless button, because what it'll do, it will flag us, and it's going to tell us that this family is a priority for us to serve them. So they would just kind of go through that. Say they're employed or they're looking for work. They would click here and they would add a couple of more questions. But the point of me sharing this with you today, though, is just to tell you that through all this, they're going to get a list of childcare referrals. Okay. Do we have enough time to do this really quickly? I don't know. Let's if we do, this is
Yeah, let's take like 2 more minutes.
Okay, great. Wonderful. Okay, so let's do this because this is really what I want to talk about. So my child, so now you're in your child part. You put, I'm employed, I'm looking for care. Now I'm here. How old is my child? Okay, I'm going to put 1. Let's do this. Let's just pick, and let's change this date here. I can do, oh, it's not going to let me do it. Let's do this. Go back a little bit. Let's do September 1, 2020. And I need the care today, right? And what, oops, sorry about that. And then what is my weekly schedule? I'm going to put full time. And then I'm going to select a full year that I need care. And if you want to add more children, you would just put this little plus button here, right? Then next, and then now I want to put my information. So I'm just going to do it real quick. I'm going to put my oops. You answer that. I'm going to put no. Do you need assistance paying for care? That question comes back up. You hit next, and here's my results. So here are my results, okay? And these are the results of all of our providers, okay? It's going to give you information. You can click on this provider and you can get more information in detail. And these are the additional filters of what you're looking for on the left-hand side of the screen. Type of care, language of care, the earliest time they open, the latest date when they close, the program type. It may be a licensed family child care home, whether small or large, or a center, after school program. And I'm just going through this really quickly for you all, but I really want families to access this because they can get a lot of information and fast if they need it. And it's really, really important because, you know, without childcare, we who can go to work, right? How can you even search for housing, permanent housing without childcare? So you would also get this information. So there's pictures up here, and our providers are, it's like a marketing tool for our providers, and they're adding things through a portal on the other side of this database. But I just wanted to give you this really pretty picture of what it looks like to get your own childcare referrals. And I'm going to stop sharing right there. And that is CoC Kids all in a nutshell to find and pay for care. But I will talk more about it in the questions. Thank you.
Thank you, Candy. That was great. I think this is super helpful. I actually didn't know that all of this existed. And I think you hit on a really key point. You know, in our system of care, we're trying to build stronger relationships with our workforce development partners. And one of the huge things, as you said, for people trying to seek employment and maybe increase their income so that they can pay for housing is childcare. So this is great. And so actually I will, since you were already talking, I think I'm going to start with you with our first question. And we have about 20 minutes for all of us to talk about this, which is from your perspective, what are the biggest challenges facing the families that you're working with as it relates to homelessness?
I think the biggest challenge is their worry about the paying for care, right? So say they're not a CalWORKS recipient, or they timed out. I don't want to use that language too much because it will be changing hopefully in the next legislation, next budget. But they're really worried about, you know, how am I going to do this? I don't have transportation. You know, will the provider pick up my child where I'm living at this time? How am I going to pay for this altogether? Like, what do I look for? What are the questions to ask? Those kind of things. I think that's the biggest challenge for our families at this time. Staff come to me all the time and they're like, you know, I have a family, they're seeking housing, they need help paying. So what do we do? And so we do have additional forms that we are working and creating to find access where the families will be able to, it would be seamless for them. I wouldn't want to say that seamless, as we're doing more enhanced childcare plans, would say a childcare plan that we're putting together for families, because housing is big, right? They need the housing, they need childcare, they need a job, all those things. And so if we can make it more seamless and simple for them, I think that's what CoC stands for, and that's what we want to do. I hope that answers your question.
Great, thank you. And I realized I totally skipped over Gina when we were doing our introductions. So we're going to take a step back for Gina to introduce herself and then answer the same question of what are the biggest challenges. So Gina, I'm going to turn it over to you. Apologies, it's a Monday.
That is quite all right. Apology accepted. Hi, everybody. I'm Gina Bills. I'm the education liaison for homeless children and families here in the county. I provide technical assistance and professional development to all 18 districts and to our homeless education liaisons throughout the county. As far as the question that we see the most.
You just muted. Thank you.
These headphones, sorry. To answer the question, I think it's not only available housing, but affordable housing. Also, from the county office standpoint, we also see that the gap in services and the lack of services, in particular, our mid-range group, our youth, our unaccompanied homeless youth, ages 14 to 17, the lack of resources there and how there is no place for them to go if they're under the age of 18. The other.
You muted again.
Sorry, it's the
There you
headphones. The last thing I wanted to add was the definition of homelessness. From our standpoint, of course, we use the legal definition of the McKinney-Vento definition, but there's also the HUD definition, which differs a little bit. And so I also wanted to just pass it over to Denise, my coworker. She was in this position forever. And Denise, if you wanted to add anything.
Sure, thanks, Gina. As Gina mentioned, I had been doing or supporting homeless families in our districts since 2008 on and off for our county. So we are coordinating a lot. And I would just echo everything she said is the difficulties, but also just referencing, just making sure our families and providers such as yourself on this call are aware of the educational rights of homeless children and youth, and just bringing that awareness so that if you're a case manager at a shelter and you're working with a family, you know who to connect them to at the school district. They have certain rights in terms of being able to continue at their school of origin before they became homeless, transportation associated with that, school supplies, uniforms, if that's a need. There's a bunch of educational rights that we just want to make sure providers and families are aware of so they and know who to go to. And so on our end, that's making sure that there's the information pathway for them to get those services. So that's all.
Thank you, Denise. I think I will go to Andrea. If you want to say anything, what are you seeing as some of the biggest challenges facing the families that you're working with?
Absolutely. So we definitely have seen the lack of affordable childcare, like Andy was showing us right now, definitely affects the ability to look for housing, to look for a job. The prices of the groceries and the gas has been something else that we have seen that definitely affect all of our homeless families. As Dana mentioned at the beginning, we see families moving in with other families for a little bit, then going out, then coming back, and they try to get to all of the resources and networks to have a place to sleep. We're also seeing that some shelters and apartments are not accepting pets. We know that pets are part of our family, and we want them to, especially if you're homeless, they become your companion. Of course, we have seen lack of affordable housing, lack of transportation, lack of mental health services as well. If you speak a different language than English, everything that I have mentioned increases in terms of a biggest barrier. If you're undocumented, it's even harder also to receive the support that you need that you need actually to be able to become housed. So those are kind of the biggest things we have seen.
Thank you. And I think it's worth mentioning, for folks that are not documented, they can access all of our crisis services, but there are some restrictions that come in when we start to talk about some housing programs if they're funded with federal housing. So people can access CORE and go to our shelters and use shower programs and food programs with no challenges. But sometimes somebody's documentation status will come up when we get into the housing programs. Lauren, go ahead.
Andrea really touched on a lot that I was going to say, but I really wanted to touch on the point that there is no family shelters or housing in the East County. So there are a couple, they're all West and Central though, and they're full and always full. But for families that have children that are in school in Antioch, Pittsburgh, Brentwood, they don't, so their kids are already going through enough. They don't want to uproot them and transfer their schools. They also don't have transportation. If they have a job in East County, the only shelters in West, it's too much. So the lack of a mental health rides, affordable childcare, everything that Andrea said. But on top of that, there's just nothing for anybody in East County. So.
Yes, you're hitting on a thing that has been an issue since I started at age 3, 7 years ago. And I'll say there was really a priority to get some brick and mortar services in East County, and train was starting to leave, and then the pandemic hit, and that all really got slowed down. So that's, I think the East County piece is really a big issue, especially when you're talking about schools and having kids have to transfer back and forth, potentially, doing a commute, really, all the way across the county. Anybody else have anything you want to say around challenges that you're seeing?
I just want to emphasize on the lack of childcare, meaning the cost of paying for the care, because, right now we are enrolling families, and the homeless family is a priority. So they have top access. When I say that, they're number one on our list. And if any of you ever need help with anything, you can, I'll put my email in the chat, but that is my priority too, to continue to advocate, whether it's locally with Measure X funding that we just received, or whether it's at the state. Because today, our childcare providers, which on the other hand are not being paid a thriving, livable wage, and so they are doing some advocacy on no childcare today. And this advocacy is federally and nationwide. So I'm excited to say that. But on the other hand, is that waiting for the May revise with the governor, we're hoping that he continues to lift up childcare for families, because without childcare, we don't have an economy, and people can't work or live or get housed or anything like that. So I just wanted to say that. Thank you.
Thank you. And actually, Candy, while you're talking, there was a question that came up earlier when you were showing your website.
Mhm.
The question was like, are all of those providers subsidized? Are all of those basically free? But it sounds like not necessarily. Can you just talk? And actually, this kind of segues into like the resources that might be helpful. So how does the subsidy work for the childcare, and how can you tell which providers might accept subsidies?
So in our database, we have licensed family childcare providers, like I was saying, small, large, a capacity of 8, capacity of 14, or a center base that's private, right? And so in our childcare in Contra Costa County, we have all of those. We have over, like I say, about 700, I don't know. There's a lot of them. Some of them have come back open since the pandemic, but those families, they use the child care voucher. So when I talk about a child care voucher, it's like a ticket where you can use this voucher to go shop for child care, right? And you get it through CalWorks. If you've been on CalWorks and you're a family on CalWorks, then you're eligible, right? So that's that eligible ticket. Then we have our non-CalWorks families that we have a waiting list for, okay? It's called the Child Care Eligibility List. And that's where I was taking you to when I said need help paying for care, you would click there. So a lot of our families, we're talking to a lot, our audience of families that receive CalWorks, right, and have that ticket, and then families that don't receive CalWorks and don't have the access. That's where we need to advocate more for those dollars. Thank goodness that we have money now, and we are enrolling families, because during the pandemic, I'm going to give you some numbers real quick and some data, is that before the pandemic, we had 2,500 children in Contra Costa County eligible and waiting for childcare that are non-CalWorks, okay? And then we have now over 5,000 children. We're cleaning up that database right now. So in 2 years, it has doubled. So we need more funding for childcare vouchers. We also have a list of subsidized childcare, and I don't want to leave our subsidized child development centers open. And everybody here knows about Head Start, right? We know about our childcare, general childcare programs like Concord Child Care Center, things like that. So we have a multiple of different that we help families navigate through this childcare system to see where their family fits and how we can help them find care.
Thank you. And Candy, one thing I'm hoping you might be able to mention, especially for families with small children that are experiencing homelessness, is Bay Area Crisis Nursery. Is that something you ever connect people to? Do you mind just doing a quick little snippet about that? Because I don't think a lot of folks know about it, and it's an incredible resource.
So thank you, Jamie, for bringing that up. I said I would talk about that. So the Bay Area Crisis Nursery is wonderful, because families are going to be able to access the Bay Area Crisis Nursery if they need childcare and they're like in a transition. So say that they need it for just a little while, right? Maybe they need it for a couple of weeks, or maybe they need it for a month. That's somewhere where we refer families to so that they can get access to childcare. It may not be permanent, but it is somewhere where they can go for a short period of time And then we work together collectively to find a permanent childcare program for their child.
Thank you. And I think Terry House dropped a link to the Bay Area Crisis Nursery in the chat. That can be a really, really helpful resource. So let's talk a little bit more about what resources have been helpful. Gina, is there anything that you want to talk about, particularly about Gina or Denise, about what the school districts offer, what other kinds of programs and supports you connect people to?
Sure. We always, of course, refer them to the coordinated entry just through 211 via H3 or CORE. The CORE team has.
Muted.
I was on such a good roll. I was saying the coordinated point of entry. So 211 and the CORE outreach team, H3, of course. The CORE outreach team has helped several of our homeless families just with basic needs or to help them get into a shelter or available housing, even on a temporary basis. From our standpoint, it's really making sure that our district liaisons are educated and getting connected to services and resources and CBOs that can help our families. Denise, do you have anything to add?
Yeah, I'll just add, so we do refer younger siblings to CoC kids for families. If we identify a school age family and they have a 0 to 5, 0 to 4-year-old, try to make sure we connect them with that resource, as well as Head Start. We have a Head Start referral form that we've shared with our district liaisons. So again, they can make an immediate referral, to Head Start, and they actually qualify for services based on that housing status. Yeah, we're focusing heavily on the 0 to 5 population going into this next year. And then for those of you who don't know, TK will be expanding by 2025 to have a space for all 4-year-olds in the county. So that is phasing in now as well. So there'll be some more public education opportunities and services along with that.
That's great. We'll definitely want to hear more about that. I'm happy to get that information out through our CoC newsletter and possibly at a Council on Homelessness meeting. So definitely we'll want to get that information out. Andrea or core teams, anything you want to say? What's been the most useful and helpful for you working with these families?
So I would say that 211 has definitely helped our families. We have also referred many people to Monument Crisis Center as they provide food. CoC Family Support Center provides counseling for fee for service and parenting classes. They were doing everything online, which has also been very helpful for those that are able to access. And the Congress of Neutrals is another agency that provides conflict resolution or mediation for those that are able to try to work things out with their landlords. And I can put the links on the chat.
That's great. And core folks, what are you finding to be the most useful and helpful as you're out in the field trying to get families connected?
So I can say the most useful that we've had would be the GRIP shelter, which we refer to them a lot when they have availability. Also would be the Mountain View House as well. We refer there when they have availability. And what has helped us a lot within the last year was the Project Room Key. When that was open, we referred most of our families there. And while they were there, they were connected with the case manager as well. And they were put into our HMIS system. And when rapid rehousing became available for certain families, we were able to house for families through them. And Lauren, do you have anything else to add about what's been helpful?
More recently, I'm new to this team. I've only been here for a couple months, but I just did a tour of the Bay Area Rescue Mission, the new family side. And I am moving in a family tomorrow, and I have 2 going for applications tomorrow because it's brand new and it's a year program. And with Project Room Creek closing down, that's going to be a good opportunity for people. I personally took advantage of the rapid rehousing program through that was with BACS until that was full. I referred as many people as I could. And then I also refer to Shelters Inc. And if they have any availability, help them with that process. Yeah.
Thank you. Anybody else on the panel have anything you want to say about what's been useful or a good resource? Okay, we're making great time, which means we're going to have a lot of time for questions at the end. So the last thing I want to just, of our sort of formal questions is, from each of your perspectives and vantage point, and I'm really, really sad that Lori McLemore is not here because I want to hear her perspective too. But this is going to queue up anybody who's in the audience who has lived experience that wants to speak to this. For our panelists, is there anything that you really want people, the audience, policymakers, what do you want people to know? What do you want the world to know about families that are experiencing homelessness? You all kind of have a front row view of what's going on, what's needed, what the challenges are. What do you want people to know? And I will, let's start with CoR. What are the things you think the community, policymakers, funders, what do people need to know?
I would start off by saying that the policy members need to know that this issue that we're having with families that are unhoused, it's getting worse and worse, you know, and due to the COVID-19, there's a lot of different families who literally don't know their rights. You know, there's families that have been getting evicted, you know, through the, I forgot how to say it, the moratorium, you know, and we see a lot of different families that are living in their cars, a lot of families that are couch surfing, a lot of families that are living in tents, and the ages of the individuals that are having children right now are getting lower and lower. You know, we have a lot of TAY. I'm the coordinator over the TAY team as well, and we have a lot of TAY families as well with small children, you know, and there's really not enough shelters at this time. You know, there aren't a lot of shelters for the amount of families that we have at this time right now. And, you know, the shelters are filling up very, very fast. We are lucky to get one bed at a shelter within 2 weeks, you know. So we've been having to use a lot of outside resources as well, and resourcing to other counties like San Francisco or Alameda County, you know, and taking these families away from all they know, you know. So it's very, very, very tough right now on the families.
Thank you. And I want to just hold space to acknowledge that it's also really, really hard on staff, I think, to be faced over and over and over again with families that are really struggling and you just don't have resources to offer them. So I just want to acknowledge that. I know it's also really hard on staff.
Right, yeah.
I can speak on that too.
Yeah.
Okay.
Because, you know, with the only family Project Roomkey hotel closing down and, you know, people having to move out of there and no additional resources for anything, to have these families calling and crying and begging, and we just don't have anything. And I personally have lived experience, not with my children on the street. I was lucky enough to have family that took them when I was living in my car. But if I didn't have that, you know, being homeless is not illegal. Nobody should have to lose their kids because they're homeless. And so there's a lot of fear with that. You know, when I used to work on the street and I ran into a mom with her children in a tent, she was terrified. And because she thought I was going to call CPS on her, but they were well taken care of. And we were able to get somewhere for her kids to stay, a family member that she needed to be honest with, and we put her in program. But not everybody is so open to receiving services. And it's a lot. It's a very hard job.
Yeah, and also to speak on the point where it takes a toll on staff, you know, like it really does. It takes a hard toll on staff when you have people calling you every single day and pouring their heart out on the phone and crying to you, you know, just for a place to sleep at night. You know, it takes a lot out of staff, you know. Staff at many times has to make different phone calls and ask for favors to different agencies in order to get these people a place just for the night. You know, some people are looking for a place just for the night. Some people are looking for a place because they have something within the next month. They just have to be indoors for at least 2 weeks, and we don't have anything to offer, you know? So it really does take us like a really big toll on the staff that we have here. Also, we only have one team. We only have two people that are on the whole Housing Works team, and we have to cover from East County, Central County to West County. You know, so we have one team that covers all of Contra Costa County, you know, and sometimes we don't even have enough staff to even cover the whole county, you know. It takes a toll when you have several clients that have mental health as well. You know, we don't have a social worker on staff right now that can help, you know, certain clients. You know, we have clients that have children that have intellectual disabilities as well, you know. So we also have clients that are in a family that have an adult that has an intellectual disability as well. And there's no place to house an individual if they're over the age of 18 and they're still under somebody's care, they're still a family. But sometimes that's not considered a family at most of our shelters as well. So they will have to go into individual rooms. You know,
Can I speak on
so,
that? Because that
yes.
actually disqualifies a family if they have, and I have on, I could think in my head at least 4 to 5 families that have an adult. She has the mother has a minor, but also has an over 18-year-old who cannot live alone, that she's also taking care of, and that disqualifies her for the shelters. And then we're telling her she has to separate her child who's disabled. So that's an issue, and also separating when there is a mother and father involved. There's nothing for 2 parents. So I'm currently have a dad on the wait list for the Concord shelter who's going to have to separate from his wife and child to get them all housed and hopefully bring them back together. So.
Right. And the only shelter that accepts men with children is GRIP, and that's in Richmond, you know, and most of our clients don't want to be in that area at this time, you know. So those are just like a brief overview of many of the issues that we have right now and that we're trying to fight through and trying to help different families. But there are a lot of successes as well, you know. So there are a lot of successes, but there's still a lot of work that's needed to be done.
I really appreciate your candor and your honesty. I think it's really important to talk about this and for people to hear what it means, you know, for families, but also for staff when there's just not enough resource for everybody. Yeah, I'm happy to hear from any of the other panelists about what's working or other challenges that you're seeing, or what do you want people to know?
Well, I would like to go next. First of all, Lauren and Robert, thank you for mentioning that. Robert, Mountain View is able to accept men right now, so we can just talk about offline about that if it's needed. And I just want to reinforce what they were saying about the families that have adults with disabilities and how, as a system, we're not able to keep them together. Also, domestic violence, we only have limited shelters in the county as well for that. And what I would like people to know is that families are working to improve their situations. We work with families that live in their cars, that have 2 to 3 jobs, but they're not able to afford any place where they can go and live, unfortunately. And that also breaks our hearts, because it's not that they're not doing their part, they're doing it. It's just not enough to get what they need to get to change their situation. And they lost hope. They lost hope because they have contacted all of us 100 times. And unfortunately, there's nothing we can do at that specific moment to support them and help them with what they need. And we're also seeing that it's a multi-generational situation that keeps going on, right? So mom and grandparents live together, and then a baby can be born in the same situation. And this continue from generations to generations. What we'll definitely like to see is the availability of more resources less restrictions in who is available or eligible to get or be part of what program, definitely. More funding in more spaces like this where different agencies that provide different support for the family as the dynamic can get together to brainstorm how to help. Because we can bring one point, but without CoC Kids, we wouldn't be able to help. Without CORE, we wouldn't be able to get the family. Without Gina and Denise, we wouldn't be able to get education piece. So it's just how really situations like this can bring all of us together to continue to work to improve our community. Thank you.
I can jump in if that's okay. No, just to speak on a couple of points, as you were saying, like staff trauma from situations, our 18 liaisons, each district has a liaison in title. It's mandated, they have to have somebody designated in that role, but they're also your foster youth liaison, your head of student services, sometimes the superintendent. They wear 5, 6, 7 hats. It's a non-funded mandate. And so, yeah, they get, families, students that come in at 4:30 on a Friday, and their goal, of course, is to bond with these families and support them educationally. But when the family really just needs housing that night or a place to go, that's where they lose the trust, unfortunately, and it puts them in a very precarious position to have that family come back to them and access services. And so we, try as best we can to do referrals, but we know it's not meeting the need, and it puts them in that situation almost daily, weekly. I'll also say our under 18 group, our TAE, who are not foster youth, the majority of our TAE housing is foster youth oriented. And so if you're a typical have never been in the foster youth system, it is very unlikely that you're going to get access to any type of shelter or housing. And 3:30 on a Friday, usually our liaison calls, and I have a teenager here, they got kicked out, they have nowhere to go. And so that's something we deal with constantly over these last 10, 12 years I've been doing this program. And then quickly, just to speak to Lauren's point, we do strongly tell our liaisons that to reiterate to families, just because you're homeless does not mean a CPS call. In and of itself, being homeless is not an automatic CPS call. We try to get that message across so clearly because we've had families living in cars and they're getting their kids to school and they're doing the absolute best they can. And so that just brought that up for me again, that we try to get that message out loud and clear. It unfortunately doesn't reach anybody, but if we can intercede, we do, and do let them know and try to get them more services. So just wanted to share that.
Just to piggyback onto Denise's comment really quickly, we know that the problem of homelessness is not going anywhere. It's only gotten worse. We do have our families that are getting their students to school, but we also need to remember the folks that are suffering from another reason of homelessness, be it addiction or the family dynamic or what's going on at home. And I think sometimes folks are just quick to say, oh, well, they're out on the street just because they want to be there. But there's underlying issues there, and we need to think of how to address everyone that's suffering from homelessness. It's really tough.
I absolutely agree with that. And I think this comes up a lot just when I'm in communities and doing presentations. And I think that the point I always make is that, like, if there's one common thread through anybody that's experiencing homelessness, it's really trauma. It's traumatic to be homeless. There's often trauma that's led to homelessness, and people manage their trauma in different ways. So substance abuse or mental health issues can either cause homelessness or really come to the forefront when this is happening. So I think that's really, really important to just acknowledge that, and to realize like that is an area also where we really need to figure out even more and better supports. And I guess related to that, like, are there specific resources that you all are finding to be helpful around mental health or substance abuse services, or is that an area where you're seeing a big gap?
I think there is a gap there, and our folks that have issues with mental health and are struggling, even if they do find a place or a shelter that can treat their mental health, the wait list is a mile long. So they go through that continuous referral system, and in the meantime, they're still out on the street.
I agree, as well as providing the services in different languages. I think that's also a humongous gap. And they can see you only once per month or something like that. So there's not constant service. So it's not really something that I think is, I mean, it helps, but it's not necessarily what we're looking for.
Yeah, I've often reached out to the core team when I'm out walking my dogs and I see someone and folks don't have a phone, or they just don't know what's available or what resources they can get immediately, or they don't know that they can qualify potentially for emergency food stamps or CalWorks for the family staying in a tent. And so I think we just need to keep being consistent with the information and making sure that everyone is knowledgeable on how to help.
Mhm. I just want to piggyback on that. Thank you all. You're great advocates. I really wish, I'm hoping that we can take this to the next level because, you know, we all know that we need funding for access. We need an East County shelter. Lauren, I'm so with you on that. I've been part of a lot of different groups and committees. I'm like, come on now, what are we going to do with our families? We have nothing in East County for our families to access a housing. So, you know, going further, I think that bringing us together because our core basic needs are not being met in Contra Costa County. And that is the huge problem. And hopefully they will hear us. We can get some money coming down somewhere and create something. And access is big. And I believe that, you know, the families, their voices need to be heard. And what they're going through and the mental health and access to health care, access to housing, access to childcare, education, all those things for their children. That is so important as we're building, you know, our Contra Costa County. And you know, it's like, okay, do we do something big and take this to another level locally? What do we do? Because we all know that our staff and ourselves talk to families all the time, and we talk to each other about having this. And I thank you, Jamie, for inviting CoC Kids. My ED, he knows that that's my heart, is like really helping. I lived in San Francisco as a child. In San Francisco, they call it milk and honey right now. Families are leaving our county to go to San Francisco to get the access to a lot of different things there. Housing, healthcare, you know, they're getting that. And what's going on with Contra Costa, I don't know, but I see Jill Ray is here with us from the office of, I don't know, I think it's Supervisor, maybe Candace, I'm not sure, Anderson, but I'm really want to do something next on, you know, how do we rebuild for families to have access, and we have the funding to help them with all these resources that they need, the basic needs.
That's actually a perfect segue. Thank you, Candy. I couldn't have paid you to script you better. I think this is a perfect segue into this community conversation about what do, you know, there are a lot of folks here on this meeting. There's 45 of us here. What are people seeing that they need? What are you seeing that's working? Are there specific questions? So I would recommend people either do the raise the hand function or put something in the chat just so we don't have total chaos. But I think this is a great opportunity to start to have that conversation about like, what do we think we need, and where are you seeing other potholes, and what else is working? So I'm just going to amplify in the chat. I mean, I just want to say to especially to those of you panelists that you know, pulled your heart out and talked about how hard this work is. I think, you know, your colleagues needed to hear that they're not the only ones. I think this is really hard work always, but especially right now, and especially for this population. I think it's real. So I just see Joe Bruno said, I had a family who was approved for quote low-income housing in Antioch, but it was still $1,700 a month, and that wasn't low enough for her. So she lost her opportunity to move into the place. We need to connect with property owners. And I think that's one of the things that's kind of my drumbeat always when I hear about affordable housing is we have to talk about extremely low and very low income affordable housing, because it's gotten to a point that you know, even what's affordable has such a broad range, and that for many of our clients, quote affordable housing is completely out of range. So I think that, you know, that speaks to advocacy. But let's see what else is in the chat. More affordable housing, there are jobs out there. So Candy says, for our staff, we need access to training and leadership. Access to trauma-informed leadership training would be great to help our teams. So this is great. I'm listening with like a couple of different ears. So we do offer, you know, trainings for homeless service providers, and I'm always looking for ideas for trainings, but also if people have trainers that they've worked with on things like this, I would love to hear. Okay, so here's a specific question. I have a single disabled mom with a 14-year-old who is homeless, currently staying in a home that is not a safe place for them. Who would be a good contact? So this is where I just want to signal boost again our 3 access points for homeless services. So there's call, which is 211. CoR, our mobile outreach team. So Robert and Lauren and the other folks on those teams, you can access by 211. And then the care centers, you can walk in, that's in Walnut Creek, there's Trinity Center, and in Richmond, there's GRIP, where you can walk in and start to connect with case management. So what I would say is, like, there's not really an easy answer about what that family needs, but starting with one of those 3 access points, part of what happens when somebody connects with those access points is there are some conversations and some triage that's happening to figure out what's happening with this person, what are the resources that they have, what is the most urgent situation, and trying to help troubleshoot so you're not giving them 40 options all at the same time. Joe, I see your hand up.
Hi, everybody. Joe here. I lived experienced advisor is where I'm standing right now as a peer advisor. I represent Delta Peers, specifically in Antioch. And I agree with the whole East County not having the services. But I wanted to jump in about the mental health side of things really quick and just kind of flag that currently there's a discussion happening within the peer support model, within the peer support network, which is the behavioral health side of things. So with this overlap, there's a current conversation about how to implement the peer model into our services of care when it concerns the unhoused population. So the mental health side of things, there's this, I don't know, a wellness plan, which is really what it's looking like. And it has a little bit to do with advocacy. It has a little bit to do, if anybody knows the SPIRIT program, it's the RAP program. It's this whole thing that's bubbling up with behavioral health and peer support. And our county is just soaking it up right now. So we're looking at, winter into spring to kind of fruition. So I just wanted to throw that out there, that there is a lot of conversation around mental health and homelessness and how it goes hand in hand, and how to bring in the peer model into this whole discussion. So that's good news. Just wanted to flag that.
Thank you, Joan. I think that's really important. One of the things that I've seen just in the 7 or 8 years that I've been in this field is a lot of us feel really siloed from each other. There's like behavioral health and it's over here, and there's homeless and it's over here, and then there's prevention. And I think there's really starting to be a stronger awareness, and not just awareness, but like action towards breaking some of that down. And because we're often working with the same people and have these like artificial barriers that make it really, really hard to serve them. So I really appreciate that you brought that perspective. There's awesome resources happening in the chat. So I won't be able to signal boost all of it, but there's some really good conversation and sharing of resources in the chat. Other folks, questions, thoughts, resources you want to bring forward? Great. So what I'm seeing is a lot in the chat is sort of like resource seeking. I think a lot of folks are faced with very complicated situations, trying to figure out, and I even get calls, medically fragile kids, especially, I actually have a son with autism, and I think about, I've heard of families where their autistic kid just can't handle being in the shelter because it's too chaotic and noisy. And yes, that's really real. So I think, I just keep thinking about different models for shelters and more availability. Jenny, are you still here? We were maybe wanting to just check in about Project Room Key. When Robert was talking, we were talking about Project Room Key hotels ending. Wondering if you could speak to that, but I don't know if you're still here. I was looking to see.
Yeah, I'm still here.
Awesome. Thank you.
Hey, not on video though, because my sound's going in and out. I'm not close enough to my router. But yeah, so with regards to Room Key, so we have one remaining hotel that's operational in West County, and we are sunsetting at the end of June. And so I think we have around 70 to 80 households that we're currently trying to find stable placements for, either interim housing, and or some of them have, many of them actually have vouchers, other permanent housing opportunities, rapid rehousing. So that's underway right now. And yeah, that's the long and the short of it. I wish I had better information. And that was our hotel that was supporting families over the pandemic.
And just to flag, the reason why they're closing is basically and this is happening all around the Bay Area, that the Project Room Key programs are ending. They were funded by the state. And as we're moving into a new phase with the pandemic, those funding sources are going away.
Yeah, that's correct. We had, throughout the pandemic, we had 5 hotels, throughout Contra Costa, and this was the last remaining hotel, and they were all funded through either state-funded Project Room Key dollars and FEMA dollars, which is a large reason why we weren't able to serve as many families as we would have liked to have seen, is because there was very strict eligibility criteria around age and vulnerability. But yeah, much of that money is now is sunsetting, and I think many of us are in the process of identifying other resources through community processes. And this is one of those meetings to gather input around where is the need, where is the largest kind of growth in our system of care, and how do we address it with a lot of the new monies that's coming in. Because just because PRK is sunsetting doesn't mean there's not a whole lot of other opportunities that are presenting that we as a community will start to figure out where we want to allocate them.
Thank you, Jenny. And one thing I wanted to say, because this comes up a lot also in the community conversations I have about shelter. And often what I hear is like, well, there's this building or there's that building. I see space everywhere. And what I've learned in doing this work is like the building or the space is not the issue. The issue is figuring out an ongoing source of funding to keep those shelters going. And that's been the challenge. And, there's a lot of money coming down from the state. But even still, a lot of that is sort of one time, or it's only going to last for a couple of years. So that's, I think, when you're thinking about your advocacy points, also having ongoing funding for homeless programs is really important. I think sometimes people want to just fund like something new and innovative and it's one time, and like, that's great to figure out what might work, but figuring out how to keep things going is really the challenge I see everybody struggling with. And all the shelters are having to cobble together like a bunch of different funding sources. It's very, very complicated. I'm seeing lots in the chat. Oh, so when does Project Room Key end? Motel 6 in Pittsburgh, when does it close? So Motel 6 in Pittsburgh, we actually purchased as a system of care. So that's now called Delta Landing. It's a permanent fixture in our community. It actually is the first brick and mortar shelter we've had in East County for a very long time. We had Don Brown shelter, which is for folks with severe mental illness, but this is the first sort of general shelter. So that is open. CORE is doing placements for Delta Landing. The Project Room Key hotels are the ones that Jenny was talking about. There's the last one is Richmond or Central County, I can't remember. But Pittsburgh is here to stay. That's ours now.
And that's only for adults, Jamie, that's only for adults.
I could speak on that.
Oh, okay.
It is for only adults. It is changed down. It's been remodeled and been transitioned into a complete shelter, meaning like no more TVs. It's the new beds, more shelter-like, to transition people into more permanent, stable housing. So it's not going to be long-term like Project Room Key. It's going to be 3 to 4, maybe 5 months for people who are working the program, getting doc ready, getting income, and wanting to transition into something more permanent.
Okay, thank you, Lauren.
And note that CORE is we are the placements for that, but right now they're emptying out the Marriott in Richmond, so we do not have access to that at the current time until that is vacated out in the Marriott.
Thank you, Michael. I wanted to signal boost something that Terry House said in the chat. And Terry, if you're able to, would love to hear your voice. She said, need for investment in homeless infrastructure in East County, homeless shelter for families and individuals, care centers so that unhoused residents can easily make that first connection to coordinated entry, and more housing that is affordable to persons with incomes from 0 to 30% area median income. So that's like extremely and very low income. Yes. Anything else you want to? say about that, Terry? And maybe you're not able to speak and that's why you put it in the chat.
Nope, I'm always able to speak, but I just always want to signal boost the need for an investment in infrastructure in East County. Fortunately, we've been able to take advantage of the low-hanging fruit that exists with possibilities and projects in Central and West County, but at some point we'll need to make that investment in East County to be able to ensure equity in our access to these resources.
Thank you, Terry. And actually that leads me to, so we did the homeless point in time count in January, and we are hoping for that data to be available soon. There's a lot of stuff happening behind the curtain, but part of what that data will show us is just like at a thumbnail sketch, sort of what the trends look like in the regions of the county. And we'll be able to see if there have been trends in terms of how many people, what proportion are in East County, West and Central. And that will also help us as a community and the Council on Homelessness, which is sort of the governing body of our homeless services, figure out how and where to make investments. But I do think it's quite marked that East County doesn't have really anything right now. And that's been a priority for a while. Other questions, comments, thoughts?
I do want to raise the idea of getting more hotels, right? Like we talk about infrastructure, that's great, but what would be the do you have to be part of the system to turn a hotel into something that, or like, can anybody just do it? Or do you have to go through the HMIS process? Can you do like a privately, I'm just going to buy this hotel and then, you know, we're going to, I don't know. I'm just, my brain is working overtime at this point right now.
It's a great question. So Jenny and Jamie, I'm going to kind of pull you in. Oh, good. I see your hand up. Go ahead.
So yes, folks are welcome to purchase hotels and use them for whatever means they'd want to. And one of our biggest shelter providers in the county, BARM, Bay Area Rescue Mission, it doesn't go through our coordinated entry. They're all privately funded. And so their new project, and I've forgotten the name, but they were calling it Bridge of Hope for a minute, was all funded through their donors and their supporters, and they just are opening up rooms for folks now. So yes, that's totally a possibility, and H3 would be thrilled to partner with folks who have those sorts of resources and are interested in turning on into those facilities. And one thing I was also going to share is that the silver lining, one of the silver linings of seeing increased numbers is that it means that we're counting people, which means that we are actually have the capacity to do the outreach. So I just want to shout out CORE because they've actually grown over the course of the pandemic and over the last few years. And so that means more people are getting access to these services, where a lot of times they might have flown under the radar and not been able to get outreached.
Thanks, Jamie.
And just really
Jamie.
quick, it's, oh, I interrupted somebody. Do you want to?
Hey, Joe, it's Jenny. Yeah, I was just going to add that home key dollars, to your question, cities, counties, COCs can apply for home key. So those large dollars that you see coming down from the state to do these hotel acquisitions and other types of acquisitions, they've now opened up, eligibility of who can apply. But to what Jamie was saying earlier, the $1 million question is ongoing operations. And so how do you sustain those operations every year to support that project that you acquired? But that's where the magic happens in grading the funding, but just wanted to throw that one out there as well.
Thanks, Jenny. What did you have, Joe?
There was a discussion earlier, but one of the things that one of my people on the network that was having a hard time with was the transitioning part of it, but where to put her stuff. Like, is there a process where there's a shelter, like not a shelter, but like storage? Is there a storage available for that transitional phase?
No.
Yeah, go ahead. I was going to say that's a great question that comes up a lot.
No, and it's often an issue for people because they don't have that much, and it's usually a 2-bag requirement. They can pack 2 large black garbage bags, that size of stuff, and anything else. They have to try to find someone that could take it in, or they can't bring it with them. So that's a barrier for a lot of people, is that sometimes that's all they have is what they have with them.
Yeah, Joe, I'm really glad you brought that up, because that's really one of the questions I often get in the community is like, why don't people want services? We're offering all this stuff and people don't want it. And what I often say is like, what we're offering may not actually be meeting people's needs. I think congregate shelter, I'm really excited that during COVID, we took the opportunity to create sleeping pods and some more privacy in our shelters. We are taking the opportunity to build more pet-friendly facilities. Belongings is another really big thing that may prevent people from going into shelter. And I think about that for myself. Like, am I willing to live with only 2 bags of all my worldly possessions? Am I willing to leave my pet behind? Am I willing to separate from my spouse? There are a lot of reasons why people don't go into shelter, or families, right? We were just talking about, like, if there's, parents that are opposite genders, like, they have to split up the family in order to access shelter. There are a lot of barriers. And I think we're really starting to figure out how to chip away at that. But it's a big deal. And the storage, the belongings is a big deal. There are, have been conversations about like, how do we build a little extra storage? But, there's also this reality that sometimes, how do you help people decide, or how do you, decide how much or what kind of stuff can come in? But it's a real issue. It's a real issue for people coming into care centers, even leaving their encampments to come into services. You have to leave, like, I don't know, I probably don't want to leave my house unlocked. So part of why I'm really excited that CoR exists, because they can come to people where they are. Oh, so this is one actually that comes up a lot. And I'm curious from the panelists, how much do you see this as an issue? So Joe said, or registration for cars that people are living in. A friend of mine just had his car towed. I hear about this a lot. And in the background have kind of been trying to figure out different resources for this. It's also an issue for some of the parking programs, like the Safe Park programs. It's an issue sometimes with encampment, like as people are thinking about sanctioned encampments. So car registration, repairs, is this something that you're seeing, and are there resources that you're directing people to? Sort of this challenge around car maintenance and registration. And Samantha, I saw you say something about St. Vincent de Paul.
Yeah, hi. I've
ahead.
had clients who are, okay, we have a dog barking. But we have clients who's receiving services at Trinity Center, who then have partnered to have car repair. They were living in their van from St. Vincent I think St. Mary's is right next to them, who is the provider. So I believe they had a good amount of car work done for that support.
Thanks for sharing that. Terry, I see you said perhaps there's an opportunity to partner with public storage agencies for donation of units for persons going into a program. Very interesting idea. I see also in the chat, I know Winter Nights has assisted clients with transportation, providing car repairs and even cars, right? And this goes back to the cascade of things, right? If you don't have a working car, then how are you getting to your employment? How are you getting to your, medical appointments? How are you getting your kids to school? Transportation is a super big challenge. And cars are expensive and gas is expensive. All of that. Great. So Alex, do you want to say something verbally? I see you put something in the chat. Are you okay to unmute and tell us? Maybe not. So Alex just mentioned that the Delta Veterans Group is going to be having a resource fair open to the community, especially veteran services. Some of these are questions in the chat. There might be programs there to help with that. So it'll be June 3rd, 4th, and 5th. Thanks for sharing that, Alex. Do I see a hand up? I feel like I see a hand up, but I can't tell whose it is.
Yes, this
Oh,
is
Dale,
Dale.
go ahead. Mm-hmm.
Yeah. Is there a list that shows what cities and the county might need to do with rules or regulations or whatever to help with all of this? Because if there is a list, then maybe a lot of us could hopefully make contact and work on our local legislators to help.
That's a great question, Dale. And I think that's actually one of the points of this forum, right? Is to help provide people with information and education so you can go out and advocate in your communities. So different cities are doing different things, have different appetites for addressing homelessness. I mean, I think there's a few different ways, and there are probably community advocates in this group that can speak to that as well. But I think overall, I would say there are some cities that are more engaged. One thing I will say is many of the cities right now are working on their housing element. So there's opportunities to really talk about extremely and very low income units, but happy to turn the floor over to people working on the advocacy piece.
One thing I would say is that at the very kind of easiest, highest level, to push your folks to support Housing First programming, because that's really about lowering those barriers. So really about welcoming in people with pets and with more possessions and making sure that however folks need to be accommodated is a priority to get them inside.
Yeah, just to put a fine point on that. So if Housing First, basically, as Jamie said, and this is actually a standard at the federal level, but privately funded programs don't necessarily have to abide by it, but it's like not requiring sobriety, not requiring that people have or a certain level of income, so that basically if you are willing to show up, we're going to try and figure out how to help you and get you in. I think in years ago, it used to basically be sort of talk about creaming, right? You're like cherry picking the people that are the highest functioning, have the most income, all of that. And then it ends up not being equitable for who can access program. So Housing First is a big deal. And we're actually going to have a Housing First training coming up in June. So stay tuned for that. Anybody else want to speak to sort of the local, what are you doing at your local level or your cities? Are there things that you're concerned about in your own cities where you need information, education, materials? Happy to open that conversation.
Looks like Jill has her hand up.
Thank you. I couldn't see it. Go for it, Jill.
Thanks, Jamie. I was waiting patiently. Dale, I just wanted to note that, and I think something that maybe H3 could look at and maybe hold up as a great model is the city of Walnut Creek. Really has wrapped their arms around this quite a lot. I mean, they've approved the Trinity Center, St. Mary's Commons. They have several housing projects that are adding permanent supportive housing units, and they've been very supportive of all of that. So I think the city of Walnut Creek could be held up as a really positive. I mean, they've had also our MET teams, and they've been a really positive model on forward thinking. So it's something to look at and something to be proud of in our county. Not all cities are pursuing at the same level. Not all cities have the same amount of funding to do that either. But it is a great model, and I think a good show in our county of what cities can do if they have the political will to do so.
Thank you, Jill. That's a perfect example. I'll say also some cities are funding their own core outreach team, so that resource is available. Some cities have their own homeless task forces that are staffed in part by the city. So Richmond and Walnut Creek, where city is actively involved in that. So there are a lot of different models. I'm happy to talk more offline, Dale, if that's helpful. Okay, somebody in the chat. Okay, somebody who can't unmute themselves. They said the Pinole Police Department is having its second Project Hope event on Wednesday, May 18th at the Motel 6 from 9 to noon. Project Hope stands for helping others through positive encounters. Through this event, we are able to help houseless individuals by connecting them to resources such as CORE and giving out essential needs kits, which are filled with hygiene products and to-go snacks. Individuals are also able to receive haircuts provided free from local salons and are able to take showers provided by Motel 6. Great. Do you know, so one thing I'll just flag is sometimes programs or facilities are not open to families with children, mostly out of just sort of like safety and security concerns. Do you know if this information, if this event is available for families? Okay, great. I see if I would like, yes, it is. Okay, great. Perfect. And in fact, when is that happening? I'm going to email you because I'm about to put out our next CoC update email, and I can include that in there. So I'm going to actually drop my email in the chat. And folks are welcome to email me anytime you want, but I would love to get a copy of that information. Great. What else? We still have a whole 25 minutes to enjoy each other and share our thoughts. I'd be curious, for those of you that are not the panelists, what brought you here today? And if there are still questions that you have or information that you're seeking. Hello?
Yeah, so to answer your first question first, why am I here? I sit on the Measure X Citizen Advisory Board, so that's a sort of super overall sales tax throughout the whole county, so I have to pay attention. I'm charged for paying attention to all 19 cities. And in my opinion, only just my opinion, just a dude, the homeless, transportation, all the needs we're talking about, childcare slots, affordability, that's a countywide thing. No city is going to take care of any of that. And so I'm trying to figure out how to help the greatest number throughout our whole county, which includes all the cities, which means we all have to work together. But one of the things that I would encourage is that July 1st or 1 July, the new budget for the county comes up. And so as a Measure X Citizens Advisory Board member, we're entertaining new presentations again. So if people want to present and make a pitch and elevate for what our needs are and why and how this is going to affect mostly who they're going to affect and what they're looking for. What we're looking for is how can we cobble together out of silo? How can we bring different groups together, innovative, bring groups together and use money that can be brought together with other money. So I know that's kind of what the overall, without picking and choosing anything, that's what we're looking for. And so that's why I'm here. So I go to a lot of things just to understand better what is going on in our own community. And just as a business person, just a person who owns a company, a manufacturing company, and the employees and their well-being for their children, not having childcare. I don't care if you're unhoused. I don't care. It just doesn't matter. Unless you can hire a nanny, there's always an issue with this thing. There's always an issue. And it doesn't matter how much money you have. There's always an issue with not enough. It's more expensive than I can afford. And are the people that are actually working in childcare, are they actually educating, nurturing, providing a learning environment for my child, nurturing environment, or are they just being warehoused? Those are things that I hear over and over and over again. And that's pervasive through, doesn't matter if you have money or not. That's just everywhere. And so I would just want to just say it's not just for unhoused, although it's acute and it's harder challenge to get around. And it's still for the 80% of us that are just women and men just trying to get through the day and get a job. That's an issue for us as well. So this is bigger than any city or anything. So that's why I'm here. I'm trying to figure all that out. And I'm trying to hear, and I talk to a lot of people when I just go places like, what do you think about this? What do you think about that? What do you think about this? Just to get input from God knows who. Anyway, that's why I'm here.
Appreciate it. Thank you. Actually, Candy, I wonder if you could just speak for a minute sort of about the process with CoC Kids and what it means to have a licensed childcare provider. And, is CoC Kids available for anyone? So if you could just talk about that a little bit, that'd be helpful.
So CoC Kids, Mr. Walker, thank you so much for bringing that up, because childcare is an economy issue, not just any issue. So thank you so much for bringing that up. So I would like to say this is that before I joined your meeting, and I'll go back to what Jamie was talking about, our Congressman Mark DeSagne was on a town hall conversation on Zoom, and he is a child care champion, and I'm gonna say why. So his long political life in politics, he has championed childcare. We have been fighting for childcare resources to pay, to make sure that the childcare program is actually a childcare program. And I'm going to say that the first standard and indicator for a quality program is health and safety. And when I mean health and safety, I'm talking about making sure that everyone has a background check in the home, making sure the home is secure, clean, and ready to serve our children, our tiniest learners. And also, we do have a lot of programs. We partner with the County Office of Education and First Five to make sure that we're ensuring that children get a quality childcare program that is with the relationship with the child and the provider. First and foremost, I would say the emotional, social needs are being met, and that the children are learning cognitive skills to prepare them for the next level, which is our kindergarten, right? And I'm talking about our earliest learners. And so we have worked on this. I partner with Denise a lot. I am the chair of the advocacy committee at the local planning council. And Mr. Walker, you are so much invited to come visit us there at the local planning council, where we all advocate for early care and education from infancy all the way up until, I'm going to say, high school, right? Our state is doing such I'm going to say this, we're on a great path. We're on a good path, and I'm going to give us credit because we're looking at cradle to career right now, right? We're looking at all those things in childcare, starting from birth all the way to the community college and CSUs and USCs. And so for us, thank you for bringing that up. So I'm going to say this. We work tirelessly and hard to make sure that childcare is all quality program for all children, and that all families have access, regardless if they are unhoused, regardless of what they're going through. They may be in domestic violence, regardless if they're working and they can't afford it. There's been at the federal conversation, we are talking about the Child Care for Working Family Act that we tried to bring to the Build Back Better, but now it's in the reconciliation plan. So what does that mean, Candy? 7% of someone's income should only go to childcare at a 7% cap. Okay, so whatever your income is, only 7% to be your childcare, because right now it's just as much as paying rent or paying for mortgage. That's how much childcare costs. It's very expensive. In our state, where we are advocating right now, this week we will have our Stand for Children event that will happen on Wednesday, that we've been doing for 25 years. And what is Stand for Children? What is Parent Voices? So we have parents and providers coming together to meet virtually. Normally we'll be at the Capitol, and I wish I had time because I would share a video of what this means and how we had childcare champions and how we got this far. Like I said, we are enrolling families right now on our subsidized childcare program for parents, so that we can help them find the care that fits their child's need with our database and partnering with private and subsidized centers. But anyways, Stand for Children will happen on Wednesday, May 11th from 3 to 4:30 on Facebook Live. And Contra Costa, as I'm the organizer and wear that hat as well, we will be talking about wages for childcare providers. We'll be talking about costs for families. We'll be talking about quality programs and how to implement that, infrastructure, because through the pandemic, we lost 20 to 25% of our providers in Contra Costa County and statewide. So I just gave you a lot of information, and I'll put some information in the chat, and I hope that answered your question. But Mr. Walker, please send anybody you know to cocokids.org or to call that number, or I put my email in the chat. But anyways, thank you so much. We do have a staff of almost 100 at CoC Kids, and we are trying to build and expand more. Thank you.
Thank you, Candy. Who else is here? Why are you here? What brought you here? Did you get what you wanted? Is there more information that you want to get?
Hi, I'm Samantha from Hume Center. Yeah, I just want to thank everyone. And I can really feel, I mean, I kind of mentioned it in the chat, but, you know, just feeling, you know, what Lauren and Robert and, you know, just everyone's feeling about, you know, we get a lot of direct contact from the rapid resolution line. It's like a step, it's like a follow-up step above 211. Like we might have some of the same resources, but we'll help hand off and we'll like call and we'll advocate. Someone will reach out to sheltering to say, hey, did they turn in all their paperwork? Can we make sure that's helped? You know, and we do stuff like that. But yeah, for families, it's just good to have these larger conversations and to share resources or what is working for people. I do know that Winter Nights has had some more openings, but again, you know, that for actual families, there's still, I think, a wait list for, you know, as of last week, there was a wait list for the parking lot program. But, you know, just trying to like share as much knowledge as we all know, but you know, sometimes you're giving people resources and you're like, you know, are other people holding information that I don't have? And it sounds like they're not. And so it feels good to, I guess, to have these maybe not quarterly, but like, I don't know, just something a couple times a year if like someone does have something going on. And I know the H3 does send things out when we all know, but even maybe just thinking of, I know there's a place and I'll post in Antioch that that is they're reaching out to their family list. And I think it's near, so I'll post that in the chat, just sharing more resources that I'm, you know, finding for my, you know, group of clients that I have, and just be a place where we can just kind of share the wealth because, you know, we all have the same common goal to house people, you know, whether it be seniors, reentry, or families, whomever it may be, and do it as quick as possible because yeah, it was really hard during the pandemic. There was no housing. There was no, you know, no wait lists were open. None of that was that. And it felt really like a standstill. So it does feel good to hear, you know, now the challenges are, can we get landlords to believe us after they've been footed a bill that, you know, that they share is pretty high in there at times. So yeah, I'll post that in the chat.
Thank you, Samantha. Anybody else? Panelists, are there things you didn't get to say that you wanted to say?
Can I tote my own horn for a minute?
Always.
That's right. Yes, that's right. So I've been doing this peer advisory work within our county for nearly 8 years now. I started in Alameda County with CAMPRO, which is California Association Peer Run Organizations, mental health peer run organizations, and working with the POCC and which is the Pool of Consumer Champions. Oh, they changed their name. But anyways, sidetracked. So I just wanted to say that I've been recognized and I will be doing a workshop for the CAMPRO Lead Conference in June. And my topic of discussion will be around how to put that peer model, the peer support specialist model, into homelessness, where the idea is to capture the lived experience story of the person who is literally in crisis, which is everybody that we're working with currently, because homelessness is a crisis. So to get that lived experience perspective and not only like help them find their own identify their own courage, but to also change policy, to also bring their lived experience to these conversations and to further with legislation and how to change policy and how to build new resources. And so I just wanted to toot my horn because, you know, Joe Bruno is doing Joe Bruno and I'm really, really excited. So that was all I wanted to share. Thanks.
That's awesome, Joe. Thank you for sharing that. I see some applause. Yay. All right, I'll leave a little more awkward silence. we're getting close to the end of our time. We did pretty well with the timing. I want to thank you all for being here, for sharing your experiences and your questions and your resources. This has been a really powerful meeting. I'm very, very sad that Lori couldn't be here, but we are, I just want to say we as a system of care are really doing some deep work to figure out how to bring the voices of people with lived experience forward in all ways and all times. And we will continue to work at that. So expect to hear more from people with lived experience. We are actually in the process of changing the name. We used to talk about consumers. So Joe, do you want to say what we're moving towards?
Oh, it's really exciting. I don't even know where to start. The equity work, and then there's a little bit of the lived experience advisory board, and
yeah. And what's
so
I was just thinking of like the new, instead of consumer, what we've landed. What I think we've landed.
That's right.
On.
Yes. Yeah. So the word consumer is being replaced with lived experience advisor. So now it'll be the lived experience advisor seat. It'll be, when we're in the paperwork, when it's addressing anybody who's quote unquote consuming our resources, they will be the lived experience advisor now. So that's super exciting.
So if you start to hear that language, that's where it's coming from. The Council on Homelessness was just talking about that the other day.
And also there's something in the chat about SSI and SSDI if you want to.
Yes, thank you. Yes, so Sharon from Contra Costa Crisis Center. I wish SSI and SSDI would raise the amount they pay. Also, I feel that we punish people who are on CalFresh when they do try to better their situation or work part-time. If they make even $1 over, they lose or have their food stamps greatly reduced. How is that helping people get out of their situation? I have no control over that, but amen. I think it's really hard. We even struggle with this, we want to compensate our lived experience advisors, and we have to be super careful that even our like little $25 stipend isn't going to send somebody over the edge and like lose their benefits. I don't have any answers for you, but yes, that's an issue.
Hey, Jamie, where should people go if they want to attend more events like this?
Oh, you're my BFF. Thank you. I am going to drop in the chat. We have a mailing list, and you can sign up to get whatever kind of information you want. We have a bunch of different options for the mailing list. So it's taking me a minute. Sorry, it's not cooperating. Sign up for the mailing list. So I'm going to put the chat in here. I've lost command of English. I'm going to put the link in the chat for how you can sign up to for the mailing list. You can also email me directly if you look at that list and you're like, I don't know where to start. I can walk through that with you. But we send out a bunch of emails, and this way you can pick exactly what you want. This is called the CoC Learning Hub. We also have what are called stakeholder meetings that are kind of those like big public community input meetings. You also might want the CoC updates, which is our monthly newsletter that has, again, like events, meetings, funding opportunities, housing opportunities. It's the smorgasbord. It's pretty broad. So thank you, Jamie. And I encourage folks, if you want to exchange your contact information in the chat, you can either private message each other, or you can just drop it in the chat if you want people to connect with you as a resource. I think we are winding down to the end of our meeting, but really, really want to thank our panelists. Thank you for all the prep time and your wisdom. Thank you for everybody that attended and your great questions. We will do more of these. And if you have ideas about other topics that you want, definitely reach out to us and let us know. We are happy to focus these on whatever topics people want to hear. I'm going to put my information in again. Oops, not Gmail. And that's it. I think we're close to done. Thanks, everybody.